What are the signs? First, already cardiac arrest had happened. What are the signs of cardiac arrest? Unconsciousness will be there. There is all symptoms. What are the signs? Unconsciousness, no pulse. That's the symptoms. Unconsciousness, no pulse, and sudden collapse. These are the signs. Next, we come to the symptoms. What are the symptoms of
chest pain?
Chest pain will be there.
Fatigue.
Chest pain radiating to the left hand, jaw, and back of the chest. Then
Angina.
that's what angina, chest pain. Then what are the symptoms? As you said, chest pain radiating to the left hand, jaw, and back of the chest. Next, sweating will be there, absolutely. Then breathlessness will be there. Yes, heaviness in the chest. Yes, these are the symptoms. Chest pain radiating to the left hand, jaw, back of the chest, heaviness of the chest, vomiting will be there, giddiness will be there. These are the symptoms. Then who are the risk? Yarella risk.
Above 45.
Age, okay, age factors. Then obesity, diabetes, yes ma'am. Hypertensive. Then
Excessive consumption of alcohol and smoking.
Smoking, absolutely. Then hereditary, absolutely, sir. Yes, anything else? Okay. There are two types of, usually we have to categorize non-modified and modified risk factors. Okay. We'll come up with the age factors. Those who are more than 60 age, they are more prone for getting a cardiac problems. And hereditary, what sir has said. And smoking, alcohol, okay, and hypertension, diabetes, sedentary lifestyle, stressful lifestyle, and drug consumption, trauma to the chest, okay, and dietary pattern. These are the patterns where can lead to the cardiac arrest. These are the risk factors. Okay, what do you mean by the stressful lifestyle and sedentary lifestyle? Stressful lifestyle, that's the family concern stress that might lead to the cardiac arrest also, and sedentary lifestyles. We all are working at industries like hospital sectors or some other industries and all. After the work, we go to the home, but still we are not happy with the hospitals. We always think about the hospitals, the recurrent call will be there. We do go. These are the things if we continue for 2 years, so that we might get a cardiac problem. These are the risk factors. How can we prevent it? However, like I just request Dr. Manjunath sir to say some preventive measures at the end of the session. Sir will brief you about how to prevent the cardiac arrest. What are the major? On the road and suddenly he fell down. So as a rescuer, what is my responsibility? Immediately I go to the John and I will see that. However, he has been fall on the middle of the road. Immediately what we have to do, we have to take him to the safest place. Okay? He fallen on the road and some victim might have fallen on the stairs also, corner of the rooms, or sometimes below the chair sometimes, or near the water. Anywhere that victim might fall on. That's what we have to take him to the safest place and make him to lie down on the flat surface. Okay? After that what we have to do? We have to ask him, and immediately what we have to do? Meanwhile we have to scan his chest and see the breathing. There is no pulse and there is no breathing. Immediately what we have to do? We have to follow a CPR sequence. That is a CAB, chest compression, airway and breathing. Under the chest compression, circulation. What are you going to do in the circulation? You have to place 3 fingers over the trachea. Slightly glue down. Okay? That's not all here, right or left. Slightly glue down in between the neck muscle and trachea. There we have to find the pulse, check the pulse, take 5 seconds, but not more than 10 seconds. There is no carotid pulse. So immediately what we have to do? Immediately activate the EMS. If it is in a community, activate 108. If it is in a hospital sector, announce the code blue. Okay? And you have to start the chest compression. So how to give a chest compression? That is a quality CPR supposed to be. As you can see, the dominant hand, Sister Sureka's dominant hand is the right hand. She is keeping her knee over the intermemory line. Or breast bone also we can call it as. If you are really confused in between the nipples, you can keep it your palm. Okay? Or 2 to 3 fingers above the required process. Okay? And however, she has been keeping her dominant hand over the intermemory line. Okay? With the other hand, she is interlocking the finger with the other hand. Keeping the other hand on the dominant hand, interlocking the finger. Okay? These fingers should be just straight and interlock the finger. Make sure we have to start the chest compression. So how to do a chest compression? That's the quality CPR. You have to keep it in mind. Okay? Make sure that wrist, elbow and shoulder should be in a straight line. So whatever pressure has been given, it should come from the shoulder. So quality CPR. Push hard, push fast. Allow the chest to recoil completely. Okay, and minimum depth of chest compression is 5 inches or 5 centimeters, but not more than 6 centimeters. And minimum of 100 to 120 chest compression supposed to be 1 minute. Okay, you can see. And okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.